All right, good morning, everyone. Thank you for joining us. Today, my name is Maura Prendeville, and my colleague Roberto Perinas and I will be discussing self-funded health plans and how they can comply with the HCSO for the calendar year 2023. I have a couple caveats here. This is not intended to be a general compliance overview. If you have not heard of the HCSO, or if you're new to it, or if you don't know whether or not your company had self-funded health plans last year, this is not the right place for you. You will be more confused. This is going to be a very technical presentation. The intended audience is brokers and employers who are already familiar with the HCSO and already know that they had self-funded health plans last year and want instructions as to how to match up their self-funded plans with the HCSO employer spending rates. If you do need a more general compliance overview, we have resources on our website, and we have plenty of resources available for that. So if you do not think this is the right place for you, please sign off, as you will get more confused. And another caveat is that we will not be discussing 2024 compliance or 2024 expenditures at all. We are only looking back at 2023. We are going to give a brief background on the rules, and then we will have a long session about how to calculate the average expenditures for last year. We will have a session about how to calculate and make your top-off payments, and then we will close with some best practices. And let's move on to some housekeeping items. Next slide, please. Yes, this webinar is going to be recorded, and yes, all the materials either in this webinar or referred to in this webinar will be on our website within 24 hours. There is a way to ask questions in WebEx. If you don't already see a Q&A panel on your toolbar, you can find one by clicking the three dots that should be either at the bottom or top toolbar in WebEx. If you click on that, you should see Q&A. You can submit questions throughout the webinar. We will stop we will do our best to answer them as they come in, but we will stop twice for Q&A, the first one after session 1 and the second time after session 2, so that we can verbally answer some of the most common questions or the questions that kind of have the broadest application to the group. If we do not answer your questions during the session, we will reply to them within 48 hours, and we will reply through, we will be tracking through the webinar software, so they will go directly to your email that you used to ask the question. Subsequent questions when the webinar ends can go to our email address at hcso@sfgov.org. That email address is going to pop up throughout the slides so that you can note it for later use. And with that, I'm going to hand it off to Roberto Perinas for the next session.
Good morning, everyone. The Office of Labor Standards Enforcement, or OLSE, is the department in the city of San Francisco that enforces labor laws. And this includes citywide laws and laws that applies to contractors, lessees, and grantees. Example of these labor laws are the Healthcare Security Ordinance, Paid Parental Leave Ordinance, Consideration of Salary History, Minimum Wage Paid Sick Leave Ordinance, Fair Chance Ordinance, Military Leave Pay Protection Act Ordinance, and Family Friendly Workplace Ordinance, to name a few. These various laws gives OLC the authority to investigate complaints for violation of any of these laws and enforcement power by requiring employers to comply with these laws. And most importantly, the OLSE offers assistance for employers. We have a technical assistance hotline, phone, and email for every law we enforce. It is always better for an employer to contact us with questions. You won't be penalized for calling. And if you realize you've been out of compliance with the law, we can talk you through how to address it. City of San Francisco passes new labor laws nearly every year, so make sure you stay on top of any laws that may apply to your business. Next slide, please. Essentially, the HCSO is a spending requirement. It requires covered employers to spend money on healthcare for covered employees at a specific rate. It's not an insurance requirement, although the most common ways to comply with the ordinance is spending on insurance. However, employers must ensure that they have sufficiently expensive insurance to comply. For 2023, the large employer rate was 3.40 per hour. For a full-time employee, this is equivalent to 584.80 a month, 1,754.40 per quarter, and in a year, that's 7,017.60. Large employers are those with 100 or more workers worldwide compared to a medium-sized employer. These are between 20 to 99 workers worldwide. Now, the medium rate for the 2023 medium rate for a medium employer was 2.27 per hour, but given that it's usually large employers who have self-funded plans, this presentation and all the examples will be focused on the large employer calculations. In 2017, the HCSO rule changed with respect to how OLSE evaluates expenditures under self-funded insurance plans. It allowed self-funded plans to look at annual rather than quarterly expenditures. You can view the full text of the HCSO rules on our webpage at sf.gov/HCSO. Next slide, please. For employees who are for covered employees by by the HCSO who are enrolled in fully funded health plans or who choose not to enroll in any of your company's insurance or are not eligible for your company's insurance, quarterly spending deadlines still apply for them. Employers must ensure that they satisfy the spending requirement on a quarterly basis for those employees. Only those enrolled in the self-funded plan can go through the annual calculation. Next slide, please. Now let's go over some basic rules for self-funded insurance. Number one, the HCSO requires employers to look at money actually spent. Starting in 2018, employers could no longer use the cover rate to calculate a plan's values since a cover rate is just an estimated value of a plan rather than a reflection of actual costs. Number two, for the types of self-funded plans in which the employer pays claims as they are incurred on a rolling basis, the calculation is done on an annual basis compared to traditional or a fully funded health plan. The calculation is done on a quarterly basis. Number three, for those plans where the calculation of expenditures is done on an annual basis, if the employer has a shortfall, additional payments can be made up to the end of February. So we're now in the time period where you are looking at expenditures for calendar year 2023, and seeing if you need to make any additional expenditures by the end of the month or February 29, 2024. Now I'll transfer to Maura to give an overview of calculation instructions.
Thank you, Roberto. I've seen some questions come in. We will get to those, but most self-funded plans fit into a scenario where the employer pays claims as they're incurred. And in this situation, they can look at the annual spend instead of the quarterly because you can spread your costs throughout the year. Roberto just said this, but we're going to repeat this throughout. The annual calculations are only for self-funded plans, not for fully funded plans or employees who are not enrolled. Those ones still have to go with the general HCSO rules and quarterly deadlines. But if you have a self-funded plan where the employer is paying claims, how do you assess the annual cost? Next slide. Next slide, please. Yeah, so a lot of employers use the HCSO's uniform coverage calculation rules in order to average expenditures among their workforce. And this applies to self-funded plans as well as regular fully funded health plans. The two most common examples are if you have an employer who has an age-banded health program, so the employer may be spending more on its older employees and less on its younger employees, the employer is allowed to average the expenditures among the whole group in order to satisfy the expenditure requirement. So you're not penalized for underspending for some groups of employees where you overspend on others if they are in a uniform health plan. Same thing with, especially in self-funded plans, you may have a wide range of costs. You may have a group of employees that are blessed with good health who have not incurred a single claim all year and have not needed any doctor's visits or anything like that, and they cost the employer nothing. And then you may have the employee who has premature triplets that are in the ICU for 10 months, and that employee has cost the employer a lot of money. You are allowed to average those people all together as long as they're in the same plan, because we recognize that different employees have different needs. A uniform health plan is one that has the same eligibility, the same co-pays, the same plan design. Next slide, please. But you can only average expenditures within a plan. So for example, most employers offer a menu of different health plans. In this example, the employer has got 4 different health plans. They each have a separate cost. You cannot average 2 different carriers together. You cannot, for example, average a Kaiser Bronze plan with a Kaiser Silver plan. They offer different things. So what an employer cannot do for HCSO purposes is an employer cannot say, hey, our company spent $6 million on healthcare last year, so we complied. That is not the case. You cannot average the Cadillac health plan offered to company executives with the low cost MEC plan that's offered to anybody else. You would have 2 different plans with 2 different averages, and they both need to meet the HCSO expenditure amount. It is very common. We see a lot of employers that have some health plans that comply with the ordinance and some that do not. That's pretty common. So next slide, please. So when you're self-funded, how do you figure out what your costs are? Well, we're going to talk through this calculation, but the general formula is you look at the cost, you take away any employee share of cost, and that gives you the spend. And again, you're doing this for each plan separately. One important thing to note here is, it's very common for employees to be contributing to the cost of their health plan. That is fine, but employee contributions are not employer expenditures. So you cannot count those towards your costs. You have to back those out. So that's why subtracting them from your total costs, anything paid by the employee cannot be counted as an employer cost. Next slide, please. Costs obviously will include any claims paid in 2023. You don't look at the date the expense was incurred, but the date it was paid. So if you have an employee who went to the emergency room on New Year's Eve 2023 and incurred a claim, most likely you have not paid that claim yet. So you don't count that for 2023. You can count it for 2024, but you can't count it for 2023 because you're only looking at claims paid. If you have dependents and you're paying claims for the dependents, of course, you can include those as well. Although remember, you back out any additional premiums that the employees are paying for those dependents. Next slide. And what is a claim? The HCSO rules look at IRS guidance as to what a tax-deductible medical expense is. For self-funded plans, we do allow some reasonable fees, such as stop-loss insurance. The cost of that can be counted as an employer cost. Excuse me. There are a lot of other fees that cannot be counted. For example, if you have paid consulting fees to design your plan, that is not a healthcare expenditure. If you are paying other costs associated with compliance for other laws, that is not a healthcare expenditure under the HCSO. So for example, if you spend money mailing the mandated ACA paperwork to employees, that is a cost of complying with the ACA. That is not a healthcare expenditure under the HCSO. We do get a lot of questions about what types of fees can be included in self-funded calculations. So if you do not know, please call us and ask. We can provide guidance, but we will need a description of the product that you are referring to. Sometimes we get calls like, can we include our wellness program? We would need more information. If you have a description from the vendor, that is usually helpful so that we can assess it. If you don't understand what you're paying for, we're not going to understand either. So make sure you give us a description of what exactly is included in this, add-on or whatever you have, and you can call us and we can tell you whether or not it counts as an expenditure under the ordinance. Next slide, please. Health savings accounts, so any employer contributions to an HSA do count as expenditures. If you have HSAs associated with different plans, then you calculate them differently. So in this example, the employer has 2 different health plans and they make HSA contributions pursuant to each plan. So they can add those to each plan. Remember that if employees are contributing to their HSAs as well, those are not employer expenditures. You can only count employer contributions to the HSAs. Next slide. This is a new example that we have gotten a couple questions on recently. Sometimes employers have kind of add-on benefits to their plans. So in this example, we have an employer with a self-funded plan that kind of allocates a certain amount of money per employee for fertility services. In this scenario, the employer knows what dollar amount was actually spent on the employees who utilized it, and the employer can add the total spent to its claims or to its expenses for that plan. Of course, any amounts that were allocated but not spent are not expenditures, but the amounts actually spent for this medical service can be counted as claims or costs for the plan. And there probably are other similar add-on programs that are structured like this that can count as expenditures. Next slide. One thing that to note is a lot of these plans are designed where the employer can get a refund for a good claims year, either money back or money credited to subsequent years. If you get money back, it is not money you have spent. So this can be a little bit tricky when you're trying to look at your costs. We recognize that a lot of the times the refunds do not necessarily match up with the HCSO deadlines. So the rule to follow is that if you have received a refund or you know how much the refund is going to be prior to the end of February, then you would just back that amount out from your costs. If after you've done your February calculations, you get a subsequent refund, then you can do a second round of calculations and a second round of top-offs. And we will get into more detail about that later. Next slide. And this one we're just mentioning because we do get questions about this every year, about the language in Rule 5.9b. The language up top sometimes confuses people, but basically what it means is this year in 2024, when you're looking back to assess the costs of your 2023 plan, you only need to satisfy the 2023 rate, not the 2024 rate. So if you're looking back to the prior year, you use the rate from the prior year. Last year's plan does not need to satisfy this year's expenditure rate. Next slide. Okay, so once you've determined what your cost is, meaning you've backed out employee costs and you've backed out refunds if you can, then you need to divide it by the hours payable and you come up with an hourly expenditure rate. But remember, you're doing this for each plan. So if you have a PPO plan, you're going to do the cost of the PPO divided by the hours for the employees enrolled in the PPO, and it gives you a rate for the PPO plan. If you have a high deductible plan, you're going to look at the employer cost of the high deductible plan divided by the hours for the employees enrolled in the high deductible plan, and then you get an average hourly rate for that plan. Next page. So there are three ways that an employer can calculate this average, and we'll go into detail about each one. But basically, the most frequently used is option A here. Most employers will look at all the employees enrolled in the plan nationwide. If it doesn't want to or has another option, it can, and if it's able to, it can also look at only the cost of the San Francisco employees. If it can do neither of these, if it's not feasible for whatever reason, sometimes an employer can't match enrollment with hours, or for whatever reason, there's a third option that we will talk about, but it's not as ideal. And one note here, you'll note throughout all of our examples that we have full-time employee hours at 2064 per year. That is because the HCSO has a maximum number of hours as 172 per month. So under the HCSO, the employers are permitted to use 2064 hours as in these calculations. You can choose to use 2080 if that's easier for you, if that's how all your payroll information is set up. That's fine, but it is easier to get to the expenditure rate if you use 2064. All right, next slide, please. Okay, so this is the most commonly used calculation. This is when an employer has a nationwide plan, and it's going to look at total costs nationwide, total hours nationwide. So it's looking at full-time versus part-time. If you have people that were enrolled part of the year, not all of the year, you can look at you can match up their hours with their enrollment. You take the total costs for that plan divided by the hours only for the employees enrolled in that plan, and then you get the hourly expenditure rate. In this scenario, the employer has not quite spent enough to be compliant for last year, so this employer will need to make a top-off, which we'll cover later. Next slide. If the employer does not want to do, and I should note, the employer can choose which calculation method it wants to use. So if you want to use option A and then use option B and see which one is more favorable to the employer, that is fine, as long as you keep records of it. Some employers, if you have the ability to break down costs by geographic region, or if there's only one plan offered to San Francisco employees or something like that, you may choose to use option B, where you're not looking at the nationwide costs, you're just looking at specifically the San Francisco costs. So in this example, rather than looking at nationwide, the employer's looking at the costs paid specifically for San Francisco employees and the hours for the San Francisco employees, and it's coming up with a rate. And then option C, next slide. This is not as popular because this is when, for whatever reason, the employer or the carrier that it's working with cannot match up the hours with enrollment information. So you can't do A or B. In this case scenario, you can use the default of 2064 payable hours for each employee that's enrolled. So that's assuming that each employee that's enrolled worked full-time for the entire year and was enrolled for the entire year. So in that scenario, you have kind of a default number to base it off of. It is just harder to get the expenditure rate if you do that. So if you have any ability to use option A, that is preferable. If you can do option B, that is also okay. If you cannot do either of those, this is the third option available. Next slide. So now you have come up with an average hourly rate for each self-funded plan that you have. And you know, in all those prior examples, the employer fell short of what it needed to spend. You likely have other expenditures that you are making for your San Francisco employees or for all your employees. So how do you account for those? You can account for other healthcare, other expenditures like dental insurance, vision insurance. If you have other types of irrevocable healthcare expenditures that you didn't already count, you can account for them here. So in this example, employer has figured out that their medical plan was valued at $294 an hour. So for an employee like Anna, who's only enrolled in the medical plan, they've got a 46-cent shortfall. But then you look at Beth. Beth is enrolled in the medical plan and also the dental plan, which the employer has calculated at 30 cents an hour. So there's a shortfall for Beth, but it's smaller because they've already made up some of that shortfall through other healthcare expenditures for Beth. Then you look at Carlos is enrolled in the medical, dental, and a vision plan. So combined, even though the medical plan fell short, the employer has already made up that shortfall through Carlos's dental and vision spending. So you would look at each individual employee and see if maybe you have already made up some of the additional expenditures that are required. Okay, we are going to take a quick break for Q&A here. The next session is going to be about top off. So I'm not going to take any questions about top offs yet, but we'll take any questions about calculating the value of the plan. Roberta will tell me if there are some, I know we've got a lot that have come in. So if there are any kind of common threads, I can address those.
Yeah, there are questions that came in through the chat box instead of the Q&A box. But anyway, I have the first question from Jennifer. Can you explain what self-funded plans mean?
Okay, yeah. This might be the wrong webinar for you because ideally, if you're on this webinar, you already have a self-funded plan. But generally, they are plans where the employer is trying to the employer bears more of the cost and more of the risk. The idea usually is that they're kind of cutting out the middleman. So for example, if an employer pays Kaiser and I pay $500 per month to Kaiser, whether or not my employee uses it, I'm spending that $500 per month. But if I decide to cut out Kaiser and I say, look, I'm going to pay for my employee whatever expenses she ends up incurring. So maybe that employee costs nothing for 1 month, and then at the end of the year, she has a car accident and has a $20,000 emergency room visit. I have to pay that $20,000. But they're usually designed, usually the employer works with the insurance broker to design the plan and build in kind of what they anticipate the costs will be. And usually there's some sort of insurance in there for large unexpected expenses. But it's basically where the employer is bearing more of the risk in exchange for cutting out more of the middleman. And it is worth mentioning that, self-funded plans have been rising in popularity because they're perceived as saving money for employers. And that there's an inherent tension there between saving money and complying with the HCSO, because the HCSO has a set amount you have to spend. So we see a lot of large national employers using self-funded plans and then paying extra attention to the San Francisco employees to make sure that they spend enough for that group of people so that they can comply with the HCSO. Let's just take one more, Roberto, because I don't want to run over time.
Another question from Iris C. What if we have a level funded plan where we pay premiums as well as claims? Our premiums alone are over the required expenditures. Do we have to do the annual math top up?
That one I would direct you to, I'll follow up with you also in email, because there is another rule called 5.9A, and I can talk you through that one. But basically, in that scenario, what we would want to know is presumably the employer may get some sort of refund at the end of, rebate at the end of the year. And if that would reduce the amount below the HCSO rate, then a top off would be required. But that one's we see that question less often, so I can get into more detail about that offline.
Another question from Laura Ayers. If we have a PPO plan and an HDHP plan, both with the same carrier, do we have to calculate their averages separately?
Yes, good question. Those are different plans. So HDHP plans always have a different benefit design than the other. Did you say PPO plan was the other one?
HDHP plan.
Yeah. So yeah, those are two separate plans. So you're going to have two separate averages. Generally, the HDHP plans are much lower cost than others. So I would expect that you probably will have top offs owed for that one, because the employers tend to not spend too much on those. But yeah, even if it's the same carrier, if it's a different plan and it's got a different structure and the employees are receiving different benefits, then they need to have a different calculation. And I do want to move on so we don't run over. So now I'm going to hand it over to Roberto, and we'll have another Q&A session after the top off discussion.
All right, so let's talk about self-funded plan top-ups. If the average expenditure falls short of the required amount for 2023, the employer must make additional payments by February 29, 2024. This is based on the HCSO Rule 5.103, which states that if an employer with a self-funded, self-insured plan fails to make the required healthcare expenditures during a calendar year, that employer shall have until the last day of February of the following calendar year to top up the expenditures and find another way to spend the required amount on behalf of the covered employees. Next slide, please. Now let's go over the top ups. Who are the employees that you are going to make top up payments? Only employees who are covered by the HCSO, meaning those workers that work 8 hours a week within the geographic boundaries of San Francisco, are entitled to receive the top-up payments. So even if average expenditures were calculated using a nationwide average, top-up payments are only owed to San Francisco employees. A payment shall be made on a pro rata basis based on the employee's payable hours during the calendar year. So you will take into consideration whether they are part-time or full-time employees. Full-time employees, that's 2,064 hours, and then half of that should be part-time employees. Former employees should also get top-up payments. Next slide, please. Here is an example of calculating the top-up payments, and we are using the scenario on the previous slides. A nationwide, Acme employer has 200 full-time employees and 50 part-time employees who work 20 hours per week. All are enrolled in the same self-funded medical plan. Of the 250 employees, 10 work full-time and 5 work part-time in San Francisco and therefore covered by the HCSO. Now, after the employer has completed the uniform coverage calculation, it has been determined that there is the nationwide average hourly expenditure was 3.24 per hour. So this is 0.16 per hour less than the 3.40 per hour expenditure requirement for large employers in 2023. The shortfall is nationwide, but only the San Francisco workers are covered by the HCSO. So out of the 250 ACME workers on the plan, only 15 employees in San Francisco are entitled to top-ups. Next slide, please. So another example how to calculate the top up, and it shows here that the employer has 0.16 per hour shortfall. For part-time employees, we take 0.16 per hour, multiply that by 1,032 hours, so that will give you the amount of 165.60 owed to its person. For a full-time employee, you take 0.16 per hour, the shortfall, multiply that by 2064 hours, that will give you 330.24 per hour for each person. So all in all, the employer will make 4,130.40 in top-up payments owed to the San Francisco workforce. Although the shortfall is nationwide for all employees, only those working in San Francisco are owed top-ups, and it's only 15 employees out of the 250, so the top-up amounts is not really that big. Next slide, please. How do you make top-up payments? The most common is by making contributions to the San Francisco City Option Medical Reimbursement Account. Another option is depositing to the employee's health savings account. And thirdly, some other form of irrevocable healthcare expenditure, but not direct payments to employees, which is not a valid way to comply with the spending requirement and does not satisfy the employer spending requirement. Now, you must ensure that top-up payments can be distinguished from expenditures made for 2024, assuming that you use city option contributions to comply with the HCSO, and for the fourth quarter of 2023, which was due on January 30, 2024, you were late and you plan to make that contribution at the same time you will make the top-up payments, you must clearly distinguish which payment goes to the fourth quarter 2023 contribution and the top-up payment so that when we review your records, we can distinguish the two contributions. The Office of Labor Standards Enforcement does not manage the city option. The city option is a different department from OLSC, and it is under the San Francisco Department of Public Health. So for any question or information you need, please contact directly the city option at their website, www.sfcityoption.org. Next slide, please. Okay, let's go this another example tops up with refunds. On our prior example, at the end of 2023, Acme Company calculated a 0.16 per hour shortfall and made top-ups by February 29, 2024. However, the following month, in May of 2024, the company receives a refund from its carrier, and then it recalculates the value of its plan, and then it came out with a true shortfall of 59.59 per hour. Now, this employer must now pay the remaining 0.433 per hour shortfall within 30 days. Uh, this is it is calculated 43 cents because 16 cents had already been paid. So true shortfall was 59 cents less 0.16. That will give you 0.33 per hour remaining amount. Now we go through the same step. For part-time employees, you take 0.43 per hour, multiply that by 1,032 hours, so that will give you 443.76 owed to its person. And then for the full-time employee, you take 0.43 per hour, multiply that by 2064 hours, that will be equivalent to 887.52 owed to its person. All in all, the employer will owe top-ups to the 15 employees in the total amount of 11,094. Next slide, please. Assuming the employer calculates the value of the plan at 2.83 per hour, in order to comply, employer must make top-ups of 0.57 per hour. Only the combination of the plan with the timely top-up gets employer to the 3.40 per hour required for compliance for the calendar year 2023 expenditure rate. But the value of the plan itself is only 2.83. In other words, top-up payments are not part of the value of the plan. Next slide, please. Let us go over who are covered employees to whom top-up payments will be made. The definition of covered employee under the HCSO stems on where the work is performed. If an employee works remotely from home, look at where the employee resides. If that employee lives in San Francisco, then she is a covered employee. If the employee does not live in San Francisco, then she is not a covered employee. Conversely, if an employee previously works remotely from home outside of San Francisco, then that person is not a covered employee. If an, if an employee is entitled to a top-up payment but work part-time in San Francisco and work part-time outside of San Francisco, her top-up is based only on her payable hours, meaning hours that were being performed or worked within the geographic boundaries of San Francisco. Next slide, please. Record keeping requirements. Generally, employer must submit the annual reporting form every April 30 each year. So the link to submit the form will be available on our webpage beginning April 1 this year. Employers must keep records for 4 years. This is based on HCSO Rule 7.2. For self-funded employers, they should keep records of the following, like calculation for expenditures of the self-funded plans, underlying data, record of claims paid, enrollment records, etc., calculations for determining the amount of the top-up payments, underlying data used to calculate the individual top-up payments, employee payroll records, and copies of communications to employees regarding the top-up payments. So it's very important that you keep these records because in case employee will have some questions regarding any type of payments or how you calculate your self-funded health plans, you have records to verify or to document it, or in case of an audit by the OLSE and we require you to submit proof that you have made top-up payments and your self-funded plans meet the required expenditure rate for a particular calendar year, then you have records to prove that you are in compliance. Next slide, please. Best practices. Employers need to communicate with the employees, inform employees that they are enrolled in a self-funded plan. Start this communication during open enrollment and in advance of significant benefit transitions if you switch from fully funded to self-funded. Tell employees, whether current and former, what the average spending plan was on the self-funded plan, the dollar amount of the top-up payment, and where the payment will be made. Consider using sample letter on the OLSE website. Next slide, please. If the payment is being made to the city option program, the employer must inform employees the contribution has been made. This is important so that your employee can proactively set up an account with the city option MRA and they can claim any reimbursement for their healthcare expenses, such as any payments for the premium or out of pocket medical care expenses. If you have any questions about city option, please call them directly through the number here or email address here. As I mentioned, the city option is a different department from the OLSE, and it is managed by the San Francisco Department of Public Health. The OLSE does not manage the city option program, so all questions should be directed directly to city option. Next slide, please. The employer must have a knowledgeable point person because if you don't, OLSC may think that you are not complying with the ordinance. Employees are likely to have questions regarding why they are not getting a top-up payment. If employees cannot get their questions answered by their employer or benefits administrator, they are likely to contact OLSE. If OLSE also cannot get questions answered in a timely manner, the employer is likely to be audited. Now, I'll give you an example for this scenario. Assuming an employer is compliant, but it outsources their HR hotline and has all benefits inquiries routed to someone at an 800 number who knows nothing about the law. So that will be disastrous because uh, ultimately the employee will question, and then sometimes because their questions will be left unanswered, they might file a complaint. So it's very important that you have an knowledgeable point person to address all these issues so that you can give the employees all the correct information as may be needed. Next slide, please. Another best practice is if you expect to have a large shortfall at the end of 2024, you can avoid a large payment in February 2025 by making top-up payments throughout the year. So over time, you spread the payments and not be burdened with a large lump sum payment the following year in February. Although this is not required, the employer can spread out the payments over time rather than being surprised at the end of the year. If you have a large shortfall for 2023, you may want to examine the employee share of costs. If that decreases, more people will enroll and employer spending increases, and shortfall may be smaller next time. You can see the examples on our instruction form available on our webpage. Next slide, please. Next slide, please. Okay. For more information on the HCSO, please visit our webpage, sf.gov/HCSO. You can sign up for updates, attend our monthly webinar, email, or call us. Our office offers technical assistance and an employer hotline for each of these laws. We encourage employers to call us with questions and we can talk you through the laws and any concerns you have about your compliance. We do not penalize employers who call us for advice about how to voluntarily fix compliance errors. We will work with you all the way so that you can address all your compliance issues. So please be proactive. If you have any questions or concerns regarding your compliance, please reach out to OLSE directly. Do not wait that there will be an employee complaint and we will audit your company. That will be the conclusion of my presentation, and we will go to the question and answer session.
Thanks, Roberto. We got a lot of questions that are a little more general and not necessarily related to top off, so I want to get to those first. There were a lot of questions about what are payable hours. So when you're calculating the average hourly expenditure, what type of hours do you use? The HCSO has a definition on our website for payable hours, excuse me, but essentially it is any hours for which an employee is legally entitled to be paid. So in California, that includes paid vacation, paid sick leave, any sort of paid leave, paid disability leave, paid maternity leave, paid bonding leave, any leave that is paid by the employer directly. So that should be counted. Unpaid leaves do not need to be counted, or any sort of unpaid time off does not need to be counted. And we also got several questions regarding, the employee enrollment changes throughout the year. Yes, it is true that all the examples in the slides are assuming, just to keep it simple, the examples assume that all the employees are enrolled for the full year and are working for the full year. But in reality, what you're going to want to do is compare your enrollment information to your employee payroll hours, because you may have an employee who signed up or who enrolled in the health plan on December 1st. You're only going to need to include 172 hours for that person, assuming they're full-time, for December, and then you'll only include also any claims for that person in December. So you'll have people that may have been enrolled for 6 months of the year or 9 months of the year or whatever. You're going to be able to count, only claims paid for them during last year, as well as only hours they worked in San Francisco during that year. So I hope that clears up a couple of things. Roberta, one question that came in that kind of goes to one of the best practices you just spoke to about is if an employee has declined the self-funded medical, but they are enrolled in a self-funded dental and self-funded vision, can we still wait until the end of the year to calculate the top off for them?
Yes, but if the employee is only enrolled on a self-funded dental and vision, that will not be enough to comply with the spending requirement for calendar year 2023. Most likely, that employer will have a large shortfall because only self-funded medical where you spend enough to meet the expenditure requirements. So that will be the likely scenario there.
Thank you, Roberto. Yeah, that was a question from Wrigley. So yes, the employer certainly is not obligated to do anything other than the annual calculations and annual top-offs, but the feedback we've gotten from employers over the last 6 or 7 years is that they always owe a very, very large amount in February. And so if they have a lot of employees in that situation, they typically choose to make payments throughout the prior year so that they don't have a huge amount owed in February. But that is at the discretion of the employer. So anytime somebody's enrolled in any self-funded plan, you can choose to wait until the end of the year to figure out what you need to top off.
I have a question here from Vanessa. It's rather, but this is the question. Rather than topping up, couldn't we just automatically use the employer rate 3.40 for each quarterly filing?
I'm not sure what you mean by that. If you're saying you're choosing to make quarterly expenditures at the required rate in addition to the self-funded plan, then yes, you can certainly choose to do that. That is not required. I don't know if I'm understanding that question correctly. Was that your understanding, Roberto?
Yes.
Okay. Yeah, if you don't want to deal with any of these calculation things and you want to pay more than is required, that is certainly not prohibited. If you only have one employee in San Francisco and you don't want to have to calculate all this, that's certainly an option. Roberto, I think I have one more question for you. Oh yeah, so if we do these calculations, and I also got this question on the hotline today. I don't know if it was from the same person, but we do all these calculations and we discover that our plans exceeded the HCSO requirements and we don't owe any top-offs. Do we need to inform OLSE or note that in any manner?
No, it's not. It's not needed. But you need to inform the employees so that they will not later on call our office and then ask us about any top-up payments. It's very important that you communicate that information to your employees.
Yeah, and just to clarify, it's not, if you don't owe employees anything, you don't have to notify them, but it's a best practice. We find that employees who have gotten something one year and don't get it the next year tend to call our office, or they may think that their employer's out of compliance or something like that. So communication is always recommended, especially when someone is not getting something that they may have been expecting. And also the only place you would need to note that your plan exceeded the spending requirement would be in your annual reporting form. we're almost at time, but we actually did get quite a few questions about the annual reporting form. So every April, every employer in San Francisco, whether or not you have self-funded plans, is required to submit a report to OLSC about how you complied with the HCSO in the prior year. So if you have a self-funded plan, your April report is where you will input your calculations. You'll say, we had, 3 self-funded medical plans. We calculated them at X per hour. We had 2 self-funded dental plans. They were calculated at X per hour. We had 1 self-funded vision plan. It was calculated at X per hour. That's the only place you would note it. You do want to keep records of your calculations and any expenditures that you made to conduct those calculations. And there were a couple questions about the annual report. That is not going to even be available on our website until April 1st, as it is every year. So there's no way to access that now. But if you're on this webinar, it should be because you're focused on the end of February deadline for your self-funded plans, and then you can move on to annual reporting.
There is a question here about the ICHRA, which I don't quite understand. The question is, do you consider expenditures for individual coverage under an ICHRA to be an expenditure under a self-funded plan?
We'll take that one offline. We'll respond to that one separately.
Okay.
Okay, I have 2 quick questions that I'm going to answer. The last 2 that came in, and then we'll have to end the webinar. One from Gabriel is premium cost sharing and eligible expenditure. I assume you mean premium cost sharing with the employee. So no, any amounts spent by the employee are not employer expenditures. We have seen situations where the employees were spending so much on their premiums and there were so little, they were costing the employer so little that the employer actually wasn't spending anything at all. So no, anything spent by the employee is not an employer expenditure. You want to back out employee premiums from any amounts that you're calculating. And then another question about payable hours from Laura. Yes, overtime hours do count because in California, overtime is legally required. So any amounts for which an employee is legally entitled to be paid in California, those count. But remember, there is a 172-hour per month cap. So if you have employees that are going way over that because of OT, you don't need to use more than that 172. All right, with that, I think we're going to wrap it up. We will have this recording and the slides, sample letters to employees, written instructions, all of that will be up on our website within the next 24 hours. Any questions that got sent through the chat or through the Q&A that were not answered will be addressed within the next, by the end of this work week, if not sooner. And thank you very much for joining.